As you can see here, we have the entire plan of you need to assess, you need to make your plan, then you need to remediate and optimize. Today, we're going to cover, for the sake of time, is just to help you with getting started and help you with your assessment, getting started with your assessment to get set up and what you need to do in that arena. And then we're going to cover a little bit into the planning phase. As you can see down below, we have a list of stakeholder education with an arrow that goes across all of those phases. And then same for your formal training, coding, clinical documentation, anatomy, physiology, etc. needs to be taking place as you go along, getting ready for your implementation and go live. And then even after that, you see that you're going to have some ongoing sustainment training that has to take place. So there's a lot of different levels of planning that needs to take place. And you really need to start doing that now to know what your long-term strategy is going to be. So the first part is anticipating your impact. How's this going to impact you for the long haul? You know that it's going to affect your clinical documentation, your coding, your payment, personnel, and budget. It's going to hit you in just about every area. It touches almost everything and everyone. And it's going to, you can see here, billing, lab, nurses, physicians, coding, all of your entire organization. The first thing you need to do is really create your key stakeholder steering committee. This is the important first step that has to be represented by your entire organization. I understand in national rural health, you have people who wear many hats. So you might have somebody that covers 2 areas. But as much as possible, you need to make sure you have somebody from each area that is represented on your steering committee. With that steering committee, it's really important because it's going to be your communication channel out to your entire organization. You're going to make sure you have executive sponsors, which is the key stakeholders, because under them there's going to be a project leader. You will have a program leader that leads your entire group. But the project leader of each area will then report to the key stakeholder, and then beneath them, they're going to have people that report to them to kind of help with the communication channel. Understanding you may not, one person may wear hats of all those roles. So it just kind of depends, but you need to make sure you're thinking through how the communication happens. We added a detailed quote here. It's kind of long, but it really sums it up. It says a critical step is the creation of a communications subcommittee to coordinate all communications about each of the interconnected health IT programs. Conflicting messages and unneeded repetition of messages to busy clinicians can be avoided through the implementation and use of this committee. Gary, do you have anything to add there?
Yeah, I would. Thank you, Linda. I mean, I think the idea here, just over the first couple of slides, I think clearly is evidence of the idea that this is more of a transformational project rather than a simple transition from ICD-9 to ICD-10. On the physician side, you're talking about an update in the level of detail needed for diagnoses. And on the procedural coding side for the facility, it's a brand new system that's never existed before. But it's far more than a coding project. I think Linda's outlined the appropriateness of recognizing that this touches people, it touches process, and it touches technology, and it requires a formal strategic planning approach that most facility leadership are already aware of from a capital planning perspective and things like that. But it's just making sure that you have those cross-functional leaders that are also managing the adoption of EHRs, that are also assisting in marketing external to patients and things of the sort. So I fully agree with that and just beg that it be seen as a truly transformational project that touches a lot of different areas, and we can get benefit out of those other areas using ICD-10 and electronic health records as kind of the foundational motivator for change. Thank you.
Thanks. So we touched on the project management. This is another key communication piece that is left out many times. The project manager is instrumental in identifying and empowering project leadership, helping establish those concrete timelines that you need to hold people accountable for so that you ensure that you're moving forward. and that every week that people are getting their work done that everybody is depending on. So you don't have hurdles that may stop moving forward in your transition. They help with bringing the group together and keeping that communication moving forward, organizing the structure and your rollout strategies and stages, helping secure resources, both financial and human. That's a really big piece that needs to be tracked and understood, because financials can run away and you can lose people. You just need to make sure you have those resources available to ensure that the project's moving forward. Making sure there's a reporting structure in place, that the communication is rolling out, and defining the metrics. You guys have to know what the success of the project is, and if you don't have that defined, it's going to be hard for everyone to feel good about finally making and meeting that goal and knowing that you did accomplish what you set out to do.